The first thing to say is there's no doubt that reconstruction improves quality of life. There have been many studies over many years, including some from this part of the world, and they all say the same thing. In addition to the issues like body image and sexuality, there are also physical problems that patients get after mastectomy, which include back pain and shoulder pain in particular. And when we see studies like acupuncture being published, we also realize that they're not easy to solve. There are no easy answers for these. So what about breast oncological surgery? In the 1980s and 90s, a lot of big studies were done that proved that breast conservation is safe, and all of these studies have published 20 or even 25-year results in the last few years. Then we went on in the 2000s to increase breast conservation. We started giving more and more neoadjuvant therapy to avoid mastectomy. There were new techniques with volume displacement or replacement and approaches borrowed from breast reduction. And there was a move towards symmetrization and a new specialty of oncoplastic breast surgery. And then there are these studies that have been published more recently. Not RCTs, but basically saying that after breast conservation, there may be a higher survival either with or without radiotherapy. So where does whole breast reconstruction, which is what we're talking about in this session, where does this fit into this whole scenario? Well, going forward, in India, these are figures from Globocan, for projected figures for 2020. 50% of the breast cancer patients that we see are still going to die, and most of those patients are going to present with advanced disease. So I think in this part of the world, we're still going to be doing a lot of mastectomies.